Wellness tips sa Health Check Plus. Katawan, kagandahan, kagalingan, ating alagaan. Dito lang yan sa Wellness tips sa Health Check Plus.
Nagbabalik ang Health Check Plus. Nandito pa rin tayo kasama si Usec Bong. Usec, matanong ko, sabi niyo po kasi kanina, so nag-start po tayo, yung appreciation din natin, tapos yung effect po ng observance of minimum health protocols po natin, like wearing of mask, and nabanggit niyo po yung pagbabakuna. Yung pong pagbabakuna po natin sa Pilipinas, nationwide, kamusta naman po yung ating mga numbers?
Alam mo, nakakatuwa nga kasi nag-peak tayo nung actually by December ng mga number of vaccinees January. Ngayon umaabot na tayo sa mga close to 67 million fully vaccinated Filipinos. Ang target ho natin, Mimi, is 90 million. So we're almost 73 or 74% of where we are. Ang target natin is 90 million to vaccinate 80% of the targeted population. So 73 tayo ngayon. We hope to reach at least 80%, reaching close to 90 million by the end of June. So
June, malapit na po, Usec.
Malapit na nga. Kaya inaano namin to ngayon. Nag-adapt na ngayon yung mga National Vaccination Centers ng other strategies. No? Kung mapansin nyo, ang mga bakuna centers, hindi na yung traditional na parang ito yung vaccination center sa hospital o dito sa mga local government units na to. Pero nagpupunta na sila sa mga areas na kung mas maraming tao, sa mga palengke, sa mga gyms na napapansin nila na mas maraming tao nagkakaroon, so para mas madali magbakuna. At saka yung strategy ngayon kasi alam ng local government unit kung sino pang hindi nababakunaan among barangay level, so kung pwede house to house yan, definitely. So ang ano natin ngayon is to ramp up the vaccination. Sana makaabot tayo ng 80% of the population or 90 million Filipinos vaccinated by the end of June.
End of June po. Yung sabi niyo po, Usec Bong, about fully vaccinated individuals. So ngayon, 67 million po tayo, and then we're targeting 90 million end of June. Tanong ko lang po siguro, so there's that target. Yun naman pong pagpapabooster naman, lalong-lalo na po sa mga adults, or yung ngayon po, sabi po, pwede pang mag-second booster na yung mga 50 years old and above. Yun po. So meron rin po ba tayong plano to open our vaccination or even our government vaccination to a second booster?
Yes, alam mo, Mimi, sa third dose pa nga lang, the first booster dose, hirap na tayo kasi parang 13% or ano lang yan, 13% lang of the targeted population ang nagkaroon ng booster dose. So mababa talaga ang booster dose natin sa first dose. Ang reason nito is kadamihan, they feel na confident na sila na hindi na sila magkakaroon ng COVID. Kaya medyo mababa pa rin yan ang ating booster dosing. In fact, meron na nga mga panukala ngayon, pag-uusapan nga sa IATF yan, kung pwede magkaroon ng legal mandate, no, for booster dose ang first booster dose. Pero hindi pa natin alam kung anong pag-uusapan dyan. Pero kailangan talaga ma-increase ang ating first booster dose. Sa second booster dose naman, meron na mga ngayon, meron na silang ginagawa po ngayon sa technical advisory group ng mga vaccines at saka sa FDA na amendahan yung EUA para dun sa fourth dose. Pero wala pang guidelines, no? So wala pang operational guidelines coming from the Department.
Sa Pilipinas po. Opo.
O sa Pilipinas at saka sa vaccine technical advisory group. So baka lalabas na ho yan kasi marami na kasi nag-second dose sa ibang bansa at saka maganda naman ang safety and efficacy ng use ng fourth booster dose. Pero hintayin natin ang operational guidelines.
And Usec, and I hope this is soon. Meron na po akong first booster dose, and yun po siguro looking forward for a second. Although Yun po, sa tingin ko naman po, malakas po yung katawan ko. When this happens po, yung second booster dose, ito, nandun pa rin po yung prioritization natin. So, health workers muna, kung merong comorbidities muna, yung ganun pa rin po, Usec Bong, yung ating ipa-follow na, kumbaga parang line of priority.
Alam mo sa second booster dose, ito yung experience ng ibang bansa nga talaga. Ang pagbigay nila is yung mga highly mga immunocompromised individuals or yung halimbawa nagkaroon ka ng kidney transplantation o may sakit ka ng cancer na nagka-chemotherapy ka, ang baba talaga ng resistance level mo diyan, kailangan mo ng second booster dose. That's a must. Pangalawa, sa mga individual sa maraming comorbidities, talagang ang hirap i-control ng diabetes, yung kanilang other metabolic disorders, kailangan talaga magkaroon ng booster dose. So ito pala yung pagkaalam ko na talagang bibigyan ng priority, lalong-lalo na sa highly immunocompromised na individuals, no? At saka yung mga adults na merong mga talagang comorbidities na nangangailangan na nakakababa ng kanilang immunity. So itong dalawang
Opo. So 13% po yung ating rate ng mga nagpa-booster na first booster dose. So third dose po ito pagka binilang natin kapag dalawang dosage po ng vaccination. Tapos yung second booster pinag-aaralan, tinitingnan po natin na maaaring sa highly immunocompromised po natin siya i-offer muna bago po sa rest of the population. Usec, yun po. So when you talk about vaccination and boosters po, yun po, ito sabi natin, it is a protection against severe COVID-19 and the severe effects of COVID-19, not actually, hindi siya blanket immunity against the infection. So it's still there. So kaya nga tayo nagmamask pa rin kahit na fully vaccinated. So Usec Bong, ang tanong ko siguro, kasi po, remember, lahat po, ako po siguro talagang pinush ko po na maging fully vaccinated na. Noon pong tumaas po yung sa Delta kasi nakita ko grabe ang daming nahihirapang huminga at ayoko yung ganong experience. Yun po. So, this was brought about by yung variants po, yung mutation na sinabi ninyo. So, ngayon po, meron po tayong naririnig na Omicron variant is now mutating to another variant of concern na po ba yun? Or ano po ba?
Alam mo, nag-mutate na nga itong Omicron 1 and Omicron 2. In fact, ang common sa atin dito yung Omicron 2 na medyo highly transmissible yon, pero hindi naman as virulent or as lethal as the Delta. Ito namang bagong variant ngayon, na-discover nila sa Thailand. So far, wala pa namang report natin sa atin dito. Pero ang na-notice po nila nito, highly transmissible, pero most ang kanilang mga pasyente asymptomatic. So sana naman, ang virus kasi pwedeng mag-mutate in two ways. Pwede siyang maging highly transmissible or less transmissible or highly virulent, talagang very toxic siya, or less virulent. So it depends on how the virus mutates. So we cannot know. It's so hard to predict mutations of the virus. Buti na lang itong mga lumalabas na mga variants ngayon, although hindi pa na-classify ito ng WHO, itong the latest, pero napansin ho na medyo kadamihan ng mga pasyente asymptomatic at although transmissible din, highly transmissible. But yun nga, at least hindi siya as virulent.
Opo, hindi po nakakamatay at hindi po nakakasira talaga ng health po. Yung kailangan ma-confine or ma-ICU. Parang ganun po yung nakikita po natin ng mga variants. Doc, sana hindi. Pero yun po, dinescribe niyo po kanina how the infrastructure is available. Yung one hospital command is now being expanded to accommodate other queries and other medical emergencies. Yung ating pong mga isolation centers, ngayon po, convert na siguro sa ibang uses and our modular hospitals are still there, available. Kapag po, sa tingin niyo po, Doc Usec Bong, kapag po mayroon na po surge ulit, ano po ang tingin niyo, sa tingin niyo po ba handa na po tayo? Handa pa rin tayo sa isang panibagong surge?
Of course, Attorney Mimi, this time it's totally different with the first surge in 2020. I think in 2 years, we were able to learn our lessons well. And definitely, kung magkakaroon ng another surge, ang mga hospitals at saka mga isolation centers, ang mga testing centers, lahat ito through the PDITR, yung prevention, detection, isolation, treatment, and vaccination strategy, may playbook na yan. Alam nila how to move around, especially with another virus. So, or another variant. So, pinaka-importante talaga, although na we were able to respond to, the threat of the COVID-19, what is very important is to note is that we were able to strengthen the health capacity system. Ito yun. Although hindi pa rin talagang as robust as that we would like it to be, but at least we have now laid the groundworks for increasing the capacity of our health system. And when you talk of health system, you just don't talk about the infrastructure, but you also talk about the surveillance. You also talk about the healthcare workers and the testings that are there. So definitely, in the last 2 years that we have medyo learned our lessons. We know how to play this game. We have a playbook for this, but it's going to be improved. So we are continuously improving it, what we've learned. So ito yung namin. These are the value or the lessons that we learned throughout the years.
Yun po. So, parang nabanggit na po, tatanungin ko sana kayo about the improvement or yung mga learnings po natin from the COVID-19 pandemic. But you said it yourself, Usec Bong, na yun nga po, one would be the strengthening of our healthcare system, meaning hindi lang po yung infrastructure mismo, katulad na nabanggit natin na pag-usapan natin kanina, like the modular hospitals or even siguro mga bagong wings po and beds sa mga ospital. Pero pati po yung ating surveillance, katulad po ng sabi niyo, grabe po dati, naalala ko nung simula pa po ng COVID-19, parang yung ano po ba yung CESU, yung epidemiologist and surveillance unit po ng bawat LGU, parang hindi rin po alam gagawin. Ngayon po parang hindi ko na sila nararamdaman, but I'm pretty sure they're still there. Sa surveillance. So nag-improve rin po ito. And then of course, our human resource. Yun po yung sabi niyo. A lot of learnings po, Usec Bong, from the COVID-19 pandemic. And I'm sure continuing po itong pagsa-strengthen ng ating healthcare system, given po nung sinabi po yung tatlong yun and more. Yun po. So siguro po, ang tanong ko, as yun po, sa DOH kunwari and other agencies, kung alam niyo po kung mayroon po mga efforts to improve it, ano pa po yung mga pagbabago na plano po natin ma-i-implement ng DOH or maaari po nating i-monitor kami po bilang mga mamamayan, and kung ano po yung siguro specifically for health emergencies or health, ano po ba tawag dito, incidents like this, ano pa po yung mga improvements na nakikita natin para maagap tayo sa mga ganitong mga mga insidente po?
Alam mo, Mimi, ang pinaka-importante talaga, as I was referring to, yung mga health systems capacity natin, talagang medyo i-improve and upgrade our frontline surveillance units. Yun yung mention mo kanila, mga RESU, CESU, ito yung mga epidemiological surveillance officers. Kailangan talaga magkaroon sila ng sapat na training, dahan-dahan eventually, to report yung mga cases, mga not just COVID but other infectious cases na on the rise. So we need this kind of frontline surveillance team. I-improve natin yung surveillance din natin sa ating genotyping, especially now na magkakaroon ng maraming variants. So kung pwede tayo magkaroon ng siguro mga laboratories aside from UPPGH Genome Center na gumagawa niyan, nasa Metro Manila lang yan, although the UP system is trying to improve this sa lahat ng mga UP systems nila, pero hindi rin niya kakayanin. So we need to also improve on the DOH side, especially yung mga tinatawag naming mga sub-national laboratories na kaya pwede din magkaroon ng surveillance for genotyping. So it's easier for us to monitor, especially yung mga mga new variants or genotypes of through sequencing of these different virus. Isa pa ang kailangan natin aside from that is of course we have to modernize and upgrade the infectious disease pavilions of mga hospitals natin. Kailangan ilagay natin yung tamang at wastong process in terms of putting up infectious centers or intensive care units. Kailangan equip sila with negative pressure, equip sila with this kind of filters of hepatitis, so on and so forth. And then you have the right machine, x-rays, ventilators. Ito yung increasing the capacity and modernizing, especially the hospitals. Kasi sila talaga yung front lines. And ito yung talagang the real access of people na nangangailangan ng severe case. We have to really upgrade and modernize them in a setting wherein they can really respond to any pandemic. And lastly, of course, alam naman natin na we are planning, there's a bill going on for the CDC, or the Communicable Disease Center, which is lodged in the department, or the CDC, just like patterned after the US. Meron tayong CDC na para sa communicable diseases na center sila, so they can actually do the monitoring, evaluation, and of course give the proper strategies and treatment for such. So malawakan talaga. It's a broader perspective now in terms of improving the health capacity.
And Usec Bong, any priorities po dito? I know na itong mga to parang na if it were pre-pandemic, ngayon po parang nakikita ko parang siyang isang environment for yung nauso po dati parang medical tourism, parang ganun po. Yung po what we had before pre-pandemic na yun po. Pero dito po sa lahat na to, meron po ba kayong syempre, priority po dito po sa mga projects na nakikita niyo na ongoing or the push by the Department of Health with policymakers? Yun po, meron po ba kayong priority push or priority po na project na naiisip?
Alam mo, itong klaseng prioritization nito, it has to be in a whole approach. So you need to approach it from the improving the surveillance. You need to approach it in terms of improving your laboratory too. You need to approach it also in improving your hospitals and their infrastructure. You need to improve also on the training of people, especially on the front lines and basically the medical specialists, especially for infectious diseases. So, and we need to improve also on a bigger perspective, an office or a facility like CDC, or Communicable Disease Center, to evaluate, monitor, and give the proper strategies for countering the whatever pandemics there. So it's a whole approach really, but it's not going to be overnight. It's going to be a slow thing, but it's not slow, but gradual, gradual improvement in all of the areas that are needed, especially when you talk of a health system.
Opo. Parang a little bit of everything, but then it's gradual, yes. Tapos yun po, but it's sure to come, yung modernization. And hindi nahuhuli. Para pong, baka naman po yung modern natin ngayon ay ma-implement natin like many years from now, and then it won't be modern anymore. Parang ganun. So talaga pong continuous. But yun po, katulad ng sabi niyo, through you po, Usec Bong, parang I realized na ang dami-dami rin po parang inopen po na opportunities or learnings po ng COVID-19 pandemic. Although hindi po natin siya mamimiss yung pandemic kapag ito po ay nawala na. Yun po.
Right. In fact, maybe just to inform you, I think this is the only time in the pandemic that they were able to produce a vaccine in 2 years' time. Usually, ang mga vaccines will take years, 10 years, more. And ito nga ngayon na nangyari sa atin, it was since it's a global impact, madalian lahat. So nagkaroon ng vaccine at in less than 2 years, nagkaroon na tayo noon. Nagkaroon ng treatment for antivirals ngayon. Compared with 2 years ago, wala talaga tayong treatment for this COVID-19. Pero meron na tayong treatment ngayon sa antivirals na lumalabas ngayon. At saka meron tayong lumalabas din ng mga monoclonal antibodies to fight or to improve the immunity of patients infected with COVID. At saka meron na rin tayong tinatawag nila ngayong yung mga vaccines na ginagawa nila ngayon na very specific for a certain variant. Parang
For a certain variant, Usec.
yeah, pero wala pa, hindi pa. That's where they're moving. That's where they're going to progress to the point that they will be able to give immunity to all those variants. So ito, iba na naman, they're working on a parang encompassing kind of vaccine and also vaccines that are very specific for certain variants. So ito yung progress natin, and it's so fast. But dito sa atin, we're trying also to cope initially, but we were able to do that. And but foremost is of course the dedication of our frontline workers. I would like to mention this because in those 2 years, it was really hard for a healthcare worker assigned in the intensive care unit, assigned for COVID or catering to COVID talaga sila. It was very hard. But they did it, and I would like to say my deep appreciation to them and for helping out. They're real heroes, really, in terms of this pandemic. Pandemic is just really a war that you don't see the enemy.
No po. Sana nga po katulad niyo po, Usec Bong, parang continuous po yung pagpapakita rin ng ating mga kababayan, pati po ng mga policy makers katulad po ninyo, ng appreciation po sa mga frontliners. Parang hindi dahil naging low risk na po tayo, ibig sabihin they take the back seat sa ating healthcare system. Talagang sila po talaga yung frontliners pa rin natin.
Sila talaga nandoon.
Usec Bong, siguro po ito po kasi parang, well, you said, yun nga, parang nakakagulat kasi progress now, allowed, kunwari po, very short short time for a vaccine, an effective vaccine na magawa po dahil dito sa COVID-19 pandemic. And siguro po, ito napapakita rin sa mga tao na there are policymakers talaga katulad po ninyo and implementers katulad po ninyo na talagang we could expect something that is fast pero hindi naman haphazard. Parang yun pa rin po, it's something that you can deliver fast or public officials can deliver fast pero hindi naman po haphazard na parang nagbigay ng something pero wala namang magiging effect sa atin or baka makasama pa yun po. Sa tingin ko po, isa po dun sa under po sa inyo ng DOH at sa inyo po inyo po, Usec Bong, yung ganito po rin, kaya nag-expect rin po yung mga tao about it. And siguro ituloy-tuloy ko na po kasi syempre magme-May na po, May 9, so it would be the elections and I think there would be a shift, there of course would be a shift from one administration to another administration. Siguro po ang tanong ko po, and this is kind of personal and I hope you answer this, kayo po ano pong plano niyo after nag-shift ng administration? So the old administration is out, someone's coming in and of course we can see that parang innate naman po sa inyo talaga yung work ninyo dyan, Usec Bong as Undersecretary sa DOH. But then do you have any plans of changing or tuloy-tuloy lang po ba? Ano pong plano niyo po after the new administration steps in?
Alam mo, Atty. Mimi, what we're trying to put in ngayon is a real a playbook on how to address the pandemic. Ipapakita po namin to through the National Task Force, through the PDITR strategy, sa ating prevention, how to go about it, detection. So we are going to complete this and give this. Parang ito yung natin. Ito yung playbook natin for the COVID-19, and this is what should be done. So ito yung pinaka maibigay po natin sa next administration. So they will actually later on follow through for what has been done and what to do. Kasi alam namin na so that for the new administration to come, it would be easier for them to go about all of the things that we've been through, especially if we come up with a playbook for our PDITR strategy on the National Task Force on how they were able to respond to the pandemic. So ito yung ginagawa namin ngayon, and we hope that we will be able to give this to the next administration para mas maganda na ngayon ang respond, and they would know how we did it and how they can improve on it better.
Po. But yung second po, kung yung playbook na to, I think it would be parang something that you would turn over to the next administration.
Yes,
Katulad po ng sabi ninyo. Yun. Pero pag in-invite po kayo to continue as serving as a undersecretary po ng health, okay pa rin po kayo, Yusek Bong.
But if there is a confidence in me, and of course, I would not hesitate to do service. I mean, it's not really the position that I'm looking for. The privilege to just serve. And, if given that confidence, why not? I mean, not everybody will be chosen for that kind of responsibility.
Okay po. Yun po. Thank you po. Parang looking forward din po sa kana yung opportunity na yun maging open dahil nakita po natin talaga kung paano kayo magtrabaho, Yusek Bong. And siguro, bago po tayo mag-end, baka po mayroon kayong message ulit sa ating mga tagapakinig at nanonood, especially po ngayon na mababa na po, nasa alert level 1 na tayo, karamihan po ng mga lugar sa atin at low risk na po tayo sa COVID-19.
Thank you, Attorney Mimi. This is my second interview sa Health Check Plus, and I would like to congratulate all of you and your staff for your second year in terms of this Health Check Plus. And thank you. You've been doing a good service to the people by this kind of information, and we do hope that this you can connect your program easily connects with the people that you would like to be with. So, salamat and congratulations to Health Check Plus. Maraming salamat for this invitation, and it's really a pleasure to be with you.
Maraming salamat po sa inyo, Undersecretary Leopoldo Bong Vega po ng Department of Health. At bago po tayo magtapos, sa ngalan po ng bumubuo ng Health Check Plus, nais ko pong magpasalamat sa mga nakikinig, nanonood at tumatangkilik sa Health Check Plus. 2 years na po tayo ngayong linggo. At 2 years na ating programa dito sa DZRH Radio at Digital TV. Nag-umpisa po tayo sa kasagsagan ng lockdown dahil sa COVID-19 noong Abril 2020. Sinamahan niyo po kami mula noon hanggang ngayon, mula Alpha hanggang Omicron. Hindi po kayo bumitaw. Kaya naman ilang beses na din po tayo naging number 1 sa Nielsen Radio rating sa oras at araw na ito. Nais kong batiin ang mga kasama ko sa Health Check Plus, ang executive producers natin, sila Virgilio Galvez, Edgar Zaragoza, Luna Lentes, si Direk Juan Carlo Tarobal at si Maurice Bennett Tarobal. Salamat din kina Attorney Reggie Pularbal, Dennis Antinor Jr., Dan De La Cruz at si Sir Melo. Lubos na pasasalamat sa mga doktor, fitness at wellness experts at iba pang research persons na nagbigay ng oras at talino sa ating programa. Mabuhay po kayo. At syempre sa Manila Broadcasting Company at sa Vital PH Science Incorporated. Hanggang sa susunod na linggo. Ako po si Attorney Mimi Campos Banaya. Tandaan, ating pangalagaan ang ating kalusugan sapagkat ang kalusugan ay ating kayamanan. At huwag kalimutang batiin araw-araw ang ating mga minamahal. Be kind, be safe, and stay healthy. Huwag pong lumabas kung hindi kailangan at kung hindi maiiwasan, ating sundin ang mga health protocols para sa kaligtasan natin ng ating pamilya at ng komunidad. Ang Health Check Plus ay production ng Vital PH Science Incorporated kasama ang Manila Broadcasting Company. Mapapanood ninyo ang iba pang video on health, wellness, and beauty sa YouTube channel ng Health Check Plus at www.youtube.com/c/healthcheckplusph.